if you're experiencing some sort of pain, how do you tell someone what it's like? Well, it's not easy because there's so many different types of pain. Like there's emotional pain, which is just in here. Like you could really be grieving if, you know, one of your mates died or whatever, but you can't tell anyone what it's like. But then there's physical pains, acute pains, like if you sprained your ankle or got accidentally stabbed or something like that. Or there's the long-term chronic pains where you've got really bad arthritis, say of your hands or your hips, and it's just dragging on, or even cancer or something like that. The important point from a doctor's point of view is that if someone comes with pain, what you do is you try and characterise it, but in the end, you quantify that amount of pain by saying, well, look, out of a scale of 10, what's it like? And like 8 out of 10 is real bad, isn't it? But if it's only 2 out of 10, well, it's not really worth whinging about, is it? So the two things I want to briefly cover today are firstly, how your brain perceives pain, and secondly, some tips on treatment. So if we look at how does your brain get the signals that something hurts? Well, what happens is if you damage your body in some way, say burn your toe, the signals are perceived by little pain receptors under the skin, and then the signals go up the nerves to your brain, and your brain suddenly registers, hell, my toe hurts, the foot's pulled back, and you work from there at trying to remove the cause of the pain. You got it? So then that leads on to affecting the nervous system using drugs to reduce the amount of pain you're receiving from these nerve signals. So the common one is paracetamol. Works very well. It's a chemical which blocks the pain receptors, and most people find it really effective for sprained ankles, headaches, stuff like that. Main thing to remember with paracetamol is too much of it can affect your liver. So make sure you stick to the right dosage, particularly in kids, all right? The other form of pain relief, which is very commonly used, is anti-inflammatories like Brufen, Naproxen, Voltaren. Now, they have the same effect as paracetamol, but they have the added effect of reducing swelling. So they're very good at anti-inflammatory, like sprained ankles or swollen knees. The main problem with them is they can tear your guts up. So if you're taking anti-inflammatory medication, make sure you take it with food, and if you get indigestion, stop it. Other form of pain relief, the opiates like codeine or morphine. These affect mainly your brain or your spinal cord, and they are very, very good. The problem is it's starting to affect your scon. So you become a little less alert, and you can get tired easily. So you've got to be very careful with driving or doing around machinery when you use anything that affects your brain. Another one like that's tramadol. So the key issue here is if you take pain relief, ask the doctor or the pharmacist exactly what are you taking and where should I be careful, and they'll tell you. Like, that's what they're paid for. So there's just a few little tips on pain relief.